In terms of breaking the cycle, there are several different categories, and I'm going to touch on each of those as we go along. You may see these terms, be familiar with what those mean. The way that you determine a fatality rate or a case fatality rate looks at an actual outbreak and the number of fatal cases divided by the total number of cases. And that really is kind of saying what percentage of the outbreak ended in death. So the bigger percentage that ends in death, obviously it's a more severe and more fatal outbreak. You also see what's called an epidemic curve, and it gives you, it's plotted on a graph. It shows you a lot of data about an actual epidemic that occurs, and it'll show you, the time lapsed from exposure to clinical symptoms, which is considered the incubation period. Other things, it's going to, show whether there's exposure at one point in time, whether exposure kind of comes and goes or is intermittent, or whether there is a continuous source of exposure that is just relentless and keeping going further and further in terms of an outbreak. So this is just one example of a sample epidemic curve. And you can kind of see it's got the percentage on the left side, and that's letting you know what percentage actually showed symptoms after how many days, and then it's showing you also the number of cases. And that's kind of letting you know, over a time period, you see kind of a increase at about day 5, and then a lull at, looks like at 9, and then again you see kind of a resurgence beginning with the epidemic, kind of resurging. So that just kind of gives you a visual impact of an epidemic outbreak. So the key things in an outbreak investigation, which public health departments are tasked with doing, is to identify the source. That means they've got to ask you and find out from the person reporting or from the individual patient that has become infected, a lot of personal questions in terms of who they've been around, sexual partners, lots of different information so that they can potentially go back. Then they would interview some of those people potentially to kind of keep investigating backward to see if they can locate what they call the source patient. Obviously, the source that is there with you, or previous patients that might be identified that led to the outbreak, the whole idea would be to isolate any source patients and then try to investigate what is the disease and the best way to break the cycle of infection or communication of that disease to additional human beings. Again, the incubation period is the time from exposure to the onset of symptoms. You may also see this term called herd immunity, and so the greater the population that is protected by vaccine, there is a kind of a immunity that occurs that protects those who are not vaccinated or chose not to be vaccinated, because they're essentially around a bigger population that is protected versus around a smaller population that is has become exposed and infected. So, that's kind of what the term herd immunity is, that there's a large herd of the population protected, and therefore other people, by virtue of numbers of who they're exposed to, may be protected as well. I'm going to touch base just briefly on sexually transmitted diseases. I'll let you read some more of this information, but there are harmful effects, as you can see, from sexually transmitted diseases, and the health department and public health has a service, to really help educate people about prevention of sexually transmitted diseases. There are more than 25 infectious agents, so there's lots of them, and there are lots of downfall harmful effects, as you can see, that come from these. Sexually transmitted infections are transmitted through sexual contact and exchange of body fluids. It is a preventable disease. Typically, by use of condoms to provide a barrier to getting infections, contact between body fluids. There is a national plan that has been in place to eradicate syphilis as a STI. So this is an example of what they call a canker sore that's located on the proximal penile shaft. And so just so you can kind of see, if you were to ever see something on somebody, this might cause discomfort. Some people who aren't very sexually active, this might not be something they're noticing a lot. So, just being aware of some symptoms that you might look for with this type of STD for syphilis. So it's important for all communicable diseases to know the risk factors, how to prevent them, and what education to provide. You all are going to pick a communicable disease that is common to potentially a larger part of your population in a county that you may intend to do more full community assessment on. But today in class, I'm going to have you do that and look for risk factors, what prevention strategies, and what education should be done for that as an exercise to practice that a little bit. So don't just pick all the common things, but think of some things that really you think you would want to know the most about. You also have diseases that are categorized as non-communicable diseases. People often will consider these chronic diseases. And as we've talked about, many of those types of diseases are huge burden on the healthcare dollars, just using up lots and lots of resources. And the more of these that you have in a community, you really cannot often have maximal potential for health, and productivity is lost because of early disability. So risk factors that contribute to these chronic and non-communicable diseases, many times we have drawn conclusions that obesity is one of those key factors, as well as other environmental factors that we've already talked about that may contribute to lung disease or heart disease, different things. I have put in your As You Learn site a couple of good videos that deal with the development of heart disease and risk factors, the development of COPD and risk factors, and then an interesting video that deals with insulin resistance and diabetes. And many times we have looked at obesity as the cause of several diseases, and it's kind of a different viewpoint on the video related to insulin resistance, because there is a potential, based on this physician's viewpoint, that somehow it's more the amount of glucose producing foods that we eat that are high sugar content or high carbohydrate content that is causing the insulin resistance, and along with that, our body is therefore becoming obese, more as a sideline symptom along with the insulin resistance, versus being obese and then the obesity itself causing it. So just a different, thought I would throw that in there for just a different thought process perhaps on, we think we know what all the risk factors of disease are, but for many of them, we're still trying to gain a better understanding of them. So anyway, you will look at some of those risk factors in your group activity, really working on non-communicable diseases as well, and trying to determine all the risk factors that could be possible, because those risk factors are going to tell you and drive through your assessment what interventions and plans and what teaching then therefore needs to go along with that. Again, nurses play a significant role in reducing this chronic disease. We've talked about that, at the primary, secondary, and tertiary level somewhat already. These are diseases that can't really be prevented through things like vaccines. They're not cured by medications. And all of them typically need long-term case management until they end in a terminal state at some point. Throughout the whole world, we have seen a huge increase of cardiovascular disease, chronic respiratory disease, and really has become the chief cause of death. So you will see a huge focus on Healthy People 2020, looking at how can we prevent these. These are just some prevention things that are listed: decreasing tobacco use, decreasing alcohol consumption, decreasing people having sedentary lifestyle, and increasing healthy eating behaviors. The Affordable Care Act has also had a big focus in terms of how to provide care for chronically ill patients. And like we've talked about previously, having these kind of delivery care models that are out in the community that are set up more to manage chronic disease versus just acute visits to a doctor's office. So this is just a picture of the chronic care model that we had already discussed in class previously. Important to note that nurses do have a huge role in this type of integrated care delivery model. We should be really at the forefront of reducing this burden of disease in the populations that are specific to the area that we're serving, while watching what the national and global trends are for the disease, and making sure that we have an impact on improvement of quality of life. Burden of disease is just really a metric that looks at how significant is the disease for the society beyond just the immediate. So several of these additional slides as we go forth are going to give you some definitions that really deal with life expectancy, what is health-adjusted life expectancy. Make sure that you're familiar with how those are calculated and what that would take into effect. Again, what is considered premature death. And then disability-adjusted life years is kind of quantifies the burden of disease because it takes into account both premature death and disability, and then lets you know how much adjustment is being made in the life expectancy based on disability. So you're going to identify many health-related non-communicable diseases that you guys are going to investigate in class, and hopefully you'll spend some time on an individual disease. I'm providing you slides on some of the most common ones and some of the most common risk factors, because we use that to make the decision on how do we prevent disease, or what behavioral changes are needed that we need to teach about or educate about. What things do we need to put in place to change that pattern? And so use the rest of these as kind of a guide as you do your assignment, along with some of the videos that are provided. If you look on through here, you get a big breakdown after this point in the slide pack that deals with the heaviest hitting diseases in the U.S., which are heart disease, cancer, chronic lower respiratory diseases, accidents, and strokes. So beyond this, you'll see there's a lot more breakdown of these and individual risk factors, and you can use those as part of your exercise today, along with some online resources.